Welcome to A Minute with Max, sponsored by the Texas and New Mexico Hospice Organization. If you would like to be kept up to date on state and federal regulations and get the most current training available, please consider joining our organization. We offer many hours of training that meet the HCSA requirements, and we also offer CEUs towards your professional licenses. In addition, Texas and New Mexico Hospice Organization represents you during the state and federal legislative sessions and at many governmental meetings. We release a weekly newsletter that ensures that you have up-to-the-minute information on what is expected at the state and federal levels. If you've not seen that regulatory update, please reach out to your administrator and ask that they share these updates with you. I think you will find them very valuable. So let's go ahead and get started. Welcome back to A Minute with Max. This month I would like to talk about one of the most common questions I get in hospice, especially with Texas providers. And the question is, can a hospice provider provide non-hospice palliative care in Texas? There's a few things that you need to know if you're a hospice provider over here in Texas. Number one, palliative care is not a licensed group in Texas. It does not fall under home health or hospice. It's kind of like an extra appendage. Now, the same services that you provide as a hospice can be provided under palliative care, but remember, under hospice, it is purely palliative care services, and you cannot call yourself a hospice provider. Now, there are some accreditation companies that offer optional accreditation for non-hospice palliative care services, and that's JACO, ACHC, and CHAP. Individual professions also can be accredited for providing palliative care. For physicians, they look to the American Academy of Hospice and Palliative Care. Nurses would look to the Hospice and Palliative Care Nursing Association. Social workers to NASW, and chaplains look to the National Association of Catholic Chaplains. There are no bill codes in palliative care. Only physicians can bill Medicare Part B for services. And finally, if a provider calls themselves a pain clinic, then they're regulated under the Texas Medical Association. So this concludes A Minute with Max, brought to you by the Texas and New Mexico Hospice Organization. And remember, we are all hospice all the time.